The orthopedic examination of the lame horse, the clinical examination, the provocation tests, the diagnostic anesthesia, and supplementary diagnostic aids. So the lameness. This is the gait abnormality. It's characterized by limping, and the affected limb has a smaller forward movement, the head nod, and facial expression and musculoskeletal pain. The steps of lameness investigation. Step 1 is history. Step 2, physical examination. Step 3 is gait evaluation. Step 4 is provocation tests. And step 5 is once the limb is identified, use diagnostic anesthesia, or you can use X-ray, ultrasound, MRI, and scintigraphy. So step 1, the history. Look at the age, the breed, the purpose. When did the lameness start? The severity, the consistency, any change in severity of training, any trauma, previous lameness, any medication, any treatment. When was the last horse trimmed, and the change in feed. Number 2 is the physical examination. Observation. Is the posture different? Any balance, symmetry, any kinds of wounds? Is a muscle development? Is the position of legs different? Is there a drop of the elbow, drop of the fetlock, such as hyperextension, or loading more on the medial side of the hoof? And the hoofs, look at the shape, the size, the posture, tail position. Is it mostly kept away from the painful leg? And palpation. Check all 4 limbs, the neck and the back. Detection of heat, swelling, and discomfort. And hoof testers. Check the 5 points on the white line. Check the frog. See if it has complete heel as well, and look for laminitis and navicular bone disorder. And the gait evaluation. See it from the side, behind, and the front. Make sure you're on an even surface, on a hard surface, and on a soft surface. And walk, trot, and include small circles. And on the lunge, look at the horse from the right side and the left side. And the provocation tests. So you hold them for 60 seconds and then you start to trot immediately after. So do the distal flexion test, which is here. This is a flexion of the fetlock joint, and the carpal flexion test, which is here. This is flexion of the carpal joint. And on the hind limb, you can do the same distal flexion test, flexion of the fetlock, and which is done here or here. And then tarsal flexion test, which is done up here as well. And then the wedge test. Put the limb on the wooden block, increase the tension, so by lifting it up, and then put the other limb and lift up the other limb to provide a full weight bearing. This is done here. And the diagnostic anesthesia. So perineal anesthesia, this is a clean procedure. So you clip the hair, aseptic scrub, use povidone and chlorhexidine, and use alcohol spray beforehand. The intrasynovial analgesia, this is an aseptic procedure. So you clip the hair, use a 5-minute antiseptic scrub, and you wash and wear sterile gloves. For the procedure, use mepivacaine or prilocaine. This is the less irritant and the duration is 2 hours. You can use bupivacaine, and it's the less irritant and the duration is 4 hours. The needles are 18 to 25 G. Use fine needles when possible. And block from the distal to proximal. So start at the bottom and go to the top. So the diagnostic anesthesia. So TPA 1 is the deep digital blocks, and MPA is the abaxial sesamoid bone. And in the case of positive TPA or MPA, you can localize further the distal interphalangeal joint, the navicular bursa, and the proximal interphalangeal joint. So the fourth one is the 4-point block. This is the metacarpal phalangeal joint, or the fetlock, and the distal flexor tendon sheet. And then you can do the high palmar block, the subcarpal block, which is the high 4-point block, and the lateral palmar block, such as the suspensory ligament, the ulnar nerve, the medius nerve, the musculocutaneous nerve, the elbow, the shoulder, and the bicipital fleet. And the hind limb, you have the perineal, so the TPA, plantar digital nerve block, the MPA is that plantar apical sesamoid nerve block, the low point nerve block, the low 4-point nerve block, the low 6-point nerve block, the subtarsal block, the tibial nerve block, and the perineal nerve block. And the reassessment of lameness. After the nerve block, so on the distal part of the limb, reassess after 10 minutes. On the tibial peroneal part of the limb, reassess after 20 to 60 minutes. And the interarticular one, reassess after 10 minutes, but it can take up to an hour.